Okay, everybody, it's now 12 o'clock, so let's start. So welcome to our seminar, which is entitled Leaving Nobody Behind, the issue about getting representativity in sample sizes for hard-to-reach populations, which is obviously what we try and do in epidemiology. We want to document the burden of health related states. We want to look for causal reasons behind exposures and effects, and we often resort to studies where we try and get a sample size that in some way is representative of populations. And the sort of aim that the thing that we often aim for are random samples, so that it means that everybody in the population has an equal chance of being selected in a study. But can we really? We can't really do that in hard-to-reach populations, or can we? Or otherwise, perhaps we do systematic samples, or we often resort to, as we shall see, into like a kind of snowball sampling, respondent-driven sampling, where we try and get everybody in a network to join a study. Now, is that the equivalent of cluster sampling? How do we ensure that we do get a representative sample? So this afternoon's brief seminar is going to be looking at two studies. Marion Heap's study on recruiting women who are deaf and reproductive age for her study, and Steph Haase's study in Kenya. So welcome to Steph from Kenya. She's here for a week and agreed to be part of this. Hard-to-reach populations, women who have sex with women. How do you recruit those for a study that is trying to elicit health outcomes and health risks for adverse sexual and reproductive health? So I'm going to hand over to them. We're going to have half an hour presentations, and then we're going to ask Jabu and Maia to respond, being our resident epidemiologists, and then open it up to the floor. So thank you very much.
I'm Marion Heap. Okay. I thought I want to say thanks again to Maia and Jabu for coming to help us. I also want you to just look at the title. Do you like the title? Not a yes or no, so I mustn't ask a yes or no question. I must ask. Exactly. No. How do you find the title? Challenging. Huh? Do you think it's cheeky? Oh, good. But otherwise, we'll blame Leslie. It's got that. Leslie's the author of the title. So he's the one we've got to blame. Okay. Now this technology is not most. Okay. So Virginia's told you that. Well, where do you think it all started? Funnily enough, it's probably military, believe it or not. This is not to laud the military. It's not to laud the warfare, but it is that where do these slogans and things come from? This actually goes back to the Spartans, to antiquity. Anyway, so but over the years it's been used by politicians. Leslie showed me Bill Clinton, Barack Obama, a bit nervous, thought I'd lost my keys, and even the Republicans. It was linked to health in 1978 at the Alma Ata Declaration. And then with the Sustainable Development Goals, it was resurrected again. And what was interesting about these goals is it's the first time ever that these big campaigns have ever included disabled people. So that's why I'm quite interested in not letting them get away with it. So if you don't want this to be a slogan, there have been some calls to action. Some of these are from the NGOs, the usual, the United Nations Development Agencies and others that have started. But we also have Michael, and I'm never terribly sure how to pronounce his name, but he talks about an inclusion health, which is the same kind of thing. And our own Linda Gale Becker, when she was interviewed last year, she was, what have we left out in terms of HIV/AIDS? Been wonderful stuff done, but she said we're still leaving out sections of the population who are hard to find. So that's the challenge. So we need, according to Leave No One Behind, an NGO, to provide new data on who's at risk of being left behind, why and where, and we'll put a spotlight. So this will put a spotlight on the most marginalized and monitor progress. Now that is what I had hoped, that we would be able to use quantitative data to put the spotlight onto disabled people. However, as you go into things like this, you start to realize that is the spotlight always going to be a good thing? What about those hard to reach populations who are at threat to imprisonment, even death? So it's lots of things to think about. So we want some reliable, robust, and representative data at one level, keeping in mind some of the challenges. And I'd like sort of cost-effective methods, like a gold standard for a hard-to-reach population, so that there is, because they're time-consuming, and therefore they're costly, and funders aren't always keen. So, and the challenge, of course, is that they're hidden, not easy to access. Then there's the ethics. And the other thing I found quite interesting the other day was in conversations, Mona and her colleagues talking about men's health. And I realized that actually sometimes they might not be hard to find, might not be hidden, but they can be hard to reach. So a number of sort of, the more you go into these things, the more complicated they become. Okay, so I'm interested, and I have got wonderful, I'm actually an anthropologist, putting my foot into these daring places. Anyway, so I have a wonderful team behind me. Leslie, Virginia, and Nesbit. Nesbit, don't forget you also part of our team, a major part. So we've been doing work quite a lot. I put the Western Cape up here for people who might not know where it is relative to the others. I know most of you do, but we do have visitors. And here's Cape Town. Most of our work's been done around Cape Town. And so Cape Town is actually, people are in the spotlight here. But Beaufort West, all these other places, which give you access to deaf people, their deaf officers and regional officers and their affiliates. We need to get out there as well, I feel. But we tried, the NRM did not like a study that we proposed for Greenberg and George. The NIH were kinder, and they gave us a chance to resubmit. So it's still hanging that way. So what we want is quantitative data of these women, of their maternal health status, pregnancies, outcomes, use of maternity services, antenatal care, childhood experiences, and their recommendations. They come through very good ones. And we want to pilot this method so that there's some kind of regular protocol that will provide reliable, valid, and the representative data. Eventually, we want representative data at this provincial level. We hope to achieve biosimilar studies across all these access points. Because this is the kind of thing, it seems to me, when you talk to them, that the demographers want. And they like to work with numbers at the provincial level. And I'm still making sense. So, okay. All right. So, on to what we've got a sample calculation for the population of the central Karoo district for these women 8 to 49 years who have various degrees of deafness. Most in that age group would have been congenital childhood deafness usually. It could be also this day and age of women who might have become deaf as a result of tuberculosis medicines. So our calculation is, the precision is a lot, 160, the next is 71, and then 37. So people are always worried as to whether we will get our numbers. So we're doing it over 2 years, 3 phases, the usual preparation, data, collection, analysis, working from Cape Town, regular site visits, and we will engage and keep in touch between visits using social media. Social media has changed communication with deaf people amazingly. I started out and we were still using phone calls and then tell them, so it's amazing. So how things have changed. So sampling strategies. We used a combination of targeting, classic snowball, moving out from Deb's database, then a variation on venue-based and location, at time and location. Deaf people are very sociable, and they often come to certain venues and they know where they will find each other. I think a lot of hidden populations tend to be like this. Stephanie will talk to you. Okay. So our aim is to, addressing the specific aim was a recruitment takes time. We fortunately know the group quite well. I think it makes a difference. It's the leadership here, their meet and greet visits, allow people to get to know you, allow them to gossip about you, because they want to know from the others, what are they like, are they okay to work? Engage them via social media. Then there was data collection, I'm not going to go into that, but it's consent, questionnaire, and return visit if the sample size is not attained. The specific aim too about the reliability is assess inter-observer agreement. I'm not sure if we give it enough time, but it's hard to get people back. So we do it at the beginning, those who come first, and ask them to stay, which is also a bit of a, not nice always to ask people to stay, but they've been very good. Sometimes it needs a bit of an incentive. We re-interview the first team. Then the validity checks given to us by 2 sources. They are regular road to health, their child's last born. We can check that at the interview. Then compare with the provincial health department records with interview responses. And that worked very well with Nesbitt's help. It was wonderful. So on the Cape Town work. So the analysis is relatively simple, and that's the kind of thing I think we need help with a lot. It draws on all the questions, they're just descriptive. Then the specific aims is the user's Cohen's kappa, interrate method, I've learned a lot, percentage agreement between, and then percentage agreement. So I'm not going to go into all of that, but most of you know that. Do you? Because I'm rushing, because I want the discussion more than the presentation, if you know what I mean. So that's why I'm rushing a bit. Okay. So we can always go back and need to have a look. Okay. Case 2. This is going to be Steph. I like the 2 cases because they give you 2 different kinds of social situations, which I think is important. Okay.
Good afternoon, everyone. Really happy to be here today and talk a bit about what I'm doing. My name is Stephanie Haase, and I've worked with hard-to-reach populations essentially my entire professional life. I started out as a physiotherapist working with children with disability in Nepal. I worked with immigrant women in Amsterdam, and for the past 8 years, I've been working with young people around sexual and reproductive health and rights in Kenya. And since I started my PhD journey, I have been working with sexual and gender minorities in Kenya. And one of the things that I think is really important is that, first of all, we have to understand the context of where people operate in, because it's the context that makes people hard to reach. It's not them themselves, it's where they operate in. So in Kenya, the case is that the penal code criminalizes all consensual same-sex activity under section 162. That is carnal knowledge against the order of nature. So technically, all non-procreative sex is criminalized with up to 14 years in prison. When I started out, and that's why I'm mentioning context, I had originally planned to also collect data in Nigeria, but was dissuaded by that very, very quickly because I would have never gotten ethics approval for collection in Nigeria, because even supporting LGBT organizations in Nigeria is against the law. So I would have done criminal activity had I done that. Those laws, even though they exist, are often not directly imposed on people. So it's unlikely that somebody will get imprisoned based on having consensual same-sex activity. However, the laws are used to stigmatize people, to violate them, to harass them, and to discriminate against them, which, of course, can have health implications. And I'm very glad that Marian mentioned hidden and hard to reach, because we're looking at, in Kenya, at LGBT or sexual and gender minority populations, men who have sex with men are actually not all that hard to reach and not that hidden, because they're considered a key population in the fight against HIV/AIDS. So there's quite a bit of information out there for MSM, for services. There are specific clinics that work around MSM. But that leaves women who have sex with women, and particularly also trans people, very much behind, and they become further pushed back into that hard to reach and hidden population space. They're also marginalized in research. If you're looking at research, there's currently around 31 studies on MSM in Kenya, most of them related to HIV, and there's 3 on women who have sex with women or trans people. So there is a definite need there for data to understand what the actual needs are of people, of women who have sex with women or trans people. Because right now we're just assuming that we understand what their needs are from other studies in the US, for example, or Australia has quite a bit of LGBT research, but we don't know. We don't understand the context well enough to understand the implications it has on women who have sex with women. And if I can pose a question to you, what do you think are some of the problems that come with those legal restrictions when, for example, recruiting people who are identifying as sexual and gender minorities? There are no wrong answers. Yes.
Well, obviously, people won't disclose their sexual habits.
Absolutely. Yeah. Yeah. And it's great, actually, that you say habits, because the penal code criminalizes behavior, not identity or orientation. It's behavior that's a problem. But thankfully, talking about the behavior is okay. That's within the legal confinement. What else?
I mean, it's not only the penal code, it's also like the zeitgeist in terms of their community's response to sexuality.
Yeah. So fear of stigmatization, violence, harassment. Yeah, exactly. The social context.
I would be afraid to be put on a list that the government might get a hold of at some point later when they decide to change the laws and make it, for example, a hanging offense.
Absolutely. Yeah. So again, fear of disclosure because of fear of something else. And the other thing is we're using labels. Just because a woman is having intercourse or any kind of sexual activity with another woman, whether it's all the time or just occasionally, doesn't mean that she identifies as lesbian or bisexual. Those are labels that we put on people and that we like to put in our inclusion criteria. But then what does that actually mean for the people on the ground that you're trying to recruit? So we need to look at those things and try to figure out how to mitigate them and how to actually include people that we want. I believe very, very strongly in the online space to reach people, particularly hard-to-reach populations. And I love that you shared your experiences with social media, because I think having this online space that tends to be anonymous, I'm not saying it's entirely anonymous, but can be, is a great way to reach people. There's no middleman involved. Even if you're collecting data, you don't have to tell anybody your story. You're not sitting face to face with somebody and have to explain what kind of behavior you had, if you ever had, for example, unprotected anal intercourse. It's hard to talk about these things, even with somebody that you trust. So having this anonymous space can be a fantastic way to do this. Also for information provision, it can be a two-way communication, actually, as opposed to a lot of just information provision via flyers or newspaper ads. You can have a two-way communication that is still relatively anonymous. However, this is, of course, not without risks and not without other problems. And I'm asking you again, what could be some of the problems with this? With using online spaces to recruit, to sample, to collect data.
We're working on the assumption that somebody has their environment access to the web.
Yeah.
There's also increasing lack of privacy and security online. But I think for me, having an anthropology background, a bigger concern with doing qualitative data collection would be the way that we interview is semi-structured and free flowing. It goes with, the conversation that that person takes a lot of the time. And you lose facial expressions, emotional responses, long pauses, their suggestions for the next direction that the conversation might go. So it would still inherently be a limited form of quality.
Yeah. Anybody else?
You still don't know if it's representative.
Absolutely, because we have no idea how big what kind of sample size to
No
calculate.
boundary.
We have no idea how many women who have sex with women, and whatever label you want to put on this, there are in Kenya in my case. So how do you calculate a sample size when you have no idea who you're actually talking to?
Also potential classification error. So many people who just participate for the fun of it or to make it up or whatever.
Exactly.
The same with telephone surveys. People make up stories.
Yeah. And then if you use incentives, how do you stop people from participating multiple times to get this incentive? So yeah, lots of questions. So again, look at the context, understand the legal context. As I mentioned earlier, collecting data on sexual and gender minority populations is legal, so that's a great start. What does it mean for informed consent, for example? Are digital signatures, are they legal? Does it actually, if somebody signs a document digitally, is that a legal thing? I've mentioned the incentives. How do you get around that? In my case, I have 4 different ways to getting around that. But of course, if somebody wants to, they can still participate twice or 3 times or 4 times. The safety issues. I have several methods, mechanisms to provide, hopefully get to a certain level of safety. The first one is that participants have to fill out a self-risk appraisal. So they have to answer questions on whether they think they would be putting themselves at risk, at economic risk, financial risk, legal risk, and so on and so forth, by taking part in the survey. They're then dissuaded from participating, but they can still participate, because I do want to have to give them that agency to say, yes, I understand my risks, but I still would like to participate. The second thing that I'm doing is I'm providing information on staying safe online. So providing people with information on passwords, clearing browser histories, using VPNs, virtual private networks, sharing devices, on how to avoid that. Because the biggest risk is disclosing, right? Disclosing one's sexual orientation or gender identity. So by looking at those things, hopefully some of the risk can be mitigated. And I link people to resources. So for example, if people have questions about legal status. I'm linking them to the Kenyan National. They have a really long name, but it's a legal network for sexual and gender minorities. So before I pass this back, I would just like to point out again that the online space does offer opportunities, but it's not without any risks. And in fact, it could even have the potential for further exclusion, such as in my case, this could be elderly and rural women who do not have access to the internet that would then be excluded from this because of network connections.
And poorer women, sometimes it's probably
I mean, in Kenya,
more sophisticated ones.
the mobile penetration is excellent. We have about a 94% mobile penetration, with 85% of the country being mobile data users. But still, there is a risk for further exclusion.
What's the cost of data in Kenya?
It's very low.
Yeah,
It's
that's a
extremely
good
low.
thing,
Yeah. And it's getting lower by the month.
Fantastic. Okay.
Okay.
Yeah.
So we'd like to have Maya and Jabu to perhaps respond to some of the issues that have been raised. So I'm not sure who would like to kick off.
Yeah, you can start off.
I really only have bad news. I'm a statistician, obviously. The truth is, no sampling is ever truly unbiased and truly representative. And it doesn't matter if you think you've got an accessible, perfectly defined sampling frame and somebody's gone and done complicated things on it. Invariably, you've still missed people or you've got some minor biases in there. With hard to reach populations, those biases are larger. But that's life, actually. And I think one thing is just kind of accepting that. I don't think you will ever have a representative sample if you fundamentally, if you can't enumerate your sampling frame, i.e. count all of your cows and then pick some of those cows, you will never have you'll never have a truly representative sample. So that's one thing. And I think maybe just sort of going away from this desire for representation, at a population level, and asking questions instead about, am I reaching the people I need to reach? Who is being excluded? So this, are rural people being excluded? Are people who say had congenital deafness and then were never entered school and so were never registered by the healthcare system being excluded? And ask yourself actually who's missing and do I need to find them? And that's context driven very much. And I guess the thing with the online sort of and using that as a frame for sampling, the questions are a little bit different. It's about duplication, it's about classification error. So if you're seeing people, for example, that are deaf, you kind of know. I mean, I guess some people could fake it, right? They know ASL very well and they could fake it, but you really need to work quite hard and have some weird desire to fake that. Whereas the online space is much more prone to fakery and that sort of thing. And that's a different issue. And I don't know that there's a simple answer for that. Other than maybe thinking hard about your questions, thinking about how could you, are there other sideways ways to kind of validate that this is really a real person, that they haven't been, that they haven't been sampled multiple times. And then there are, of course, some complicated statistical methods that you can use to try and help adjust for that. But, it's a hard problem. And there's actually no easy answer. And the other thing is about cost effectiveness. Well, it'll never be cost effective. It'll never be cost effective to go after hard to reach in small populations. It just costs money. And from a public health perspective, like that's where it's on the big low hanging fruit. And then these hard to reach populations, although not unimportant, are proportionally much smaller, and therefore it's always going to cost more to find. Okay, unless they're very well identified. And this is square registries and that sort of thing are helpful. But obviously, you're not going to have a registry of people who have same-sex encounters, right? Because there are reasons for that. So I think to some extent it might be actually moving away from saying, well, we need this perfect sample, you're not going to have it, and asking, are you reaching the people you need to reach? And do you need to modify the methods you use to analyze or the inference you make on those samples in order to say something sensible about those populations? And that would be my take on it. Hammer them with the hammer on the other side.
Yeah, well, I think you captured much of what I was going to say. It's not, Stefan, it wasn't clear to me which of these methods you think you are using, because using the way about thinking about online platform, it could be the way of reaching people, but it's not necessarily as sampling strategy. So I wasn't clear about what you have in mind about the sampling strategy you're using, or you are defining using online as a sampling strategy. But so what I could say is that you could think of online platform as one way of reaching people. Again, you have to think about who is on some of these social platforms and who's not. And when you talk about these, trying to aim for representativeness. And I think it's important to be at least explicit about which sampling approach we're using. And of course, like Maia said, none of these methods are perfect, and they each have limitations. So that's.
One other general comment about kind of the difference between these two studies, as far as I understand them. I mean, there's a difference between sampling from kind of a known sampling frame. Actually, my impression is that the deaf mothers is actually almost a known sampling frame. So some people won't be known, but it indicated that there was a population of 274. That's very specific.
And that's according to the census, which is not always.
It's mostly a known sampling frame in the sense that you've got a pretty rough idea of the population. You might be missing some people, and some people might have left and that sort of thing. And in which case you can select a sampling method, and that's actually pretty classical sampling. This other problem is that actually the sampling frame is totally unknown, right? You will have some people that are willing to identify as a sexual minority or something like that. You'll have a bunch of people that don't even think about that, because although they might engage in women who have sex with women occasionally, they might not even consider themselves as one of those people. And so your sampling frame is fundamentally unknown and completely unknowable. And that's a really classically really different problem, right? Because you don't actually have a sampling frame. You can't say what proportion of the population. Who knows? Are you reaching them? Who knows? And so in that case especially, it's really important to reframe the question around, am I reaching enough of the people, of the representation people that I expect to see? Who's missing structurally from my choice of sampling methods? Because you don't actually know, and you won't know, you can't answer. So in some sense, that there are a little bit different problems.
Yeah, and in addition to that is also, being disabled is not legal.
Yeah.
That is true.
And the populations definitely have legal issues you have talked about. So yeah, that's another complexity. Trying to reach the population.
Okay, some burning questions already, and then if you want to think about how you'd like to respond as well. Okay, we'll start with Jane and then to Jane.
So I have a question, maybe you could answer it, but for the hidden population that will have sex with women, I just want to know why you wouldn't consider using the example if you're not already, because that's a method that's sort of been tried on the other problems for hard to read populations for MSM, or drug use. So it's a complicated method, but the methodologically it's got its flaws and it's got its strengths. And maybe the context in Kenya, but I would imagine there should be, would be able to find key informants maybe in Kenya, but maybe you aren't in your channel.
So actually, I'm working with key informants on the politics, doing RDS.
It was exactly the same. I wondered about this one.
Sorry. No, you go.
Just the same question. It's obviously a core question here about defining the sampling frame and the different approaches. If you're doing RDS qualitative and a online-based sampling for quantities or something, have you matched? Have you looked at what disparities there are between those two groups?
I'm not there yet.
That would be interesting.
That's your plan.
Perhaps you could describe how you're going to be recruiting women to participate in online and casuals and things like that. That might also help.
Yeah, so I'm starting out essentially. Mine is a convenient sample. I'm working with organizations that work with women who target sexual and gender minorities. Also as a trust level, that people actually understand that there is this certain responsibility in it. So it's and snowballing. So people are given links to the survey that they can share with other people who may be interested in it. To calculate my sample size, because I had to at some point, I'm actually, because I will be using regression models as my analysis, I'm going with a rule of 10. So 10 events per variable in the association models. And just to be on the safe side, I'm doing the rule of 20.
Yeah, it's good that guesses in.
Yeah.
We just make it up.
Can I follow up on that?
Yes,
Because
okay.
that rule of 10 and rule of 20 pops up every now and then. We got both of you here. What's your view on the rule of 10 and rule of 20?
And maybe explain it more to people because it's a little bit outside of some of
Well,
our
it's a debate.
advices.
I guess you could it's ongoing debate. It's based on when you are doing your regression. It depends on how many variables you're going to look at, and the more you want to look at, the more sample size you need. So that's one of the recommended is for each of the variable you're planning to
Or level,
yeah,
or level,
yeah,
or discrete
or
variable.
Or level.
Or discrete variable. So if you have a discrete variable
It
with
come
10,
up to quite a
oh
lot.
yeah, no, it adds up quick.
Yeah.
This is why if you've got 50 or 60 individuals in your study, you really can only look at 3 or 4 covariates. It's about precision of the estimate. Right? I mean, it's a very ad hoc rule of thumb.
Because the more variables you add, the more, if you think about you are breaking this in smaller cells, then the more variables you have in some cells, you have 1%, 0, and then there's a certainty about the statistic.
Everyone believes it.
It's an approximation. It's very hard to make real sample size calculations for complex models. You can't except for simulation. Nobody wants to spend 3 months doing a simulation. So you make up a number that's approximately big enough. And that's, remember, sample size is just an estimation. It puts you in the right ballpark.
But the other recommended approach decide on, because in your study you would look at different things. So you have like 2 or 3 aims. How do you have to estimate the sample size based on one of those? And usually some of the recommended approaches estimate your sample size based on the aim that would like have a lot of statistical like rigor or robustness. So that those are the sort of trade-offs. But again, it's not a perfect. None of these things are perfect.
Marfion,
Yeah, thanks for a great discussion. And let me qualify, I'm much more of a qualitative researcher than anything else. But I mean, these challenges of the sampling frame is in populations that, for example, the women who have sex with women. I mean, this is the reason why we use flexible study designs, because fixed designs you can't do a sample. So you move to building trust, snowball sampling. It's like you're engaging across study designs, and you're actually in a flexible study design. And then that raises for me the question of representation for who and for what purpose. Because, for example, so policymakers often want representation to a geographic level, but that's not always possible. So there's also this idea that qualitative research is not as robust as this kind of geographic representation, which we have to also challenge. So Marion's work that she has done over the years, the qualitative research, is so rich and so wonderful. So it just raises more questions about, the purpose of representativity and for who, and what we need to do with policymakers about that. Yeah.
Can I just chime in, because I was going to ask a similar question, and just to say maybe slightly less so Stephanie's study, but Marion's study. As far as I remember, there was quite a not the sample size was small for the quant aspect of that study, but the vast majority of that study was around qualitative questions and methods. And then it just sort of strikes me the concept of leave no one behind. If I apply that as more about, do we have deaf voices speaking in this space? Do we have, rather than are all of the deaf voices in this space speaking, have we covered absolutely every person? Because at some point, like saturation, and there's all sorts of things around that qualitative data that sort of makes it more about, like, if you're talking about experience of mental health services, sure, cover, urban, rural, that sort of spread, but like beyond that point, it's not necessarily about speaking to absolutely everyone who represents like a real characteristics that you're looking at. So I'm just curious about, is this about speaking the language of funders and policymakers?
It is speaking the language of policymakers. They do not listen to qualitative. It is not to miss. A researcher of my kind of standing does not get a voice in unless it looks scientific. And that I am an anthropologist, and I see that as making it meaningful for policymakers. Culture for an anthropologist is not a noun, it's a verb. To put meaning on this population needs numbers. They will be left behind. So tired of being left behind. Yeah. And so we have this opportunity now to put them onto the provincial database, which will make research so much easier. So that's the kind of thing. So it is trying to find their language.
Because I think if you can say that 80% of the deaf women in our study argued that no midwife could understand what they were saying, and so it gave them a really negative experience of childbirth, rather than 10% or a few, So I mean, it carries weight, and it does impact. It's qualitative information, but that carries weight, and if you've got numbers associated, it makes a big difference.
Do you also want us to have a conversation at some point about challenges?
Yeah, I think it depends on what you want to communicate. Because I think if the argument is these are hard to reach population, and we know nothing about what's the burden of HIV, what is the burden of other risk factors. Then you're asking a different question. Representativeness there means something else as compared to, or we don't even talk about the hard to reach population. So again, I think it's one thing about what are you trying to achieve by what you're doing, and if it work if you present statistics to policymakers that, oh, this is an issue that they need to pay attention to. Unfortunately, they want the number, they want the statistic. But in some cases, it may that statistic may not be as useful. But it depends on what do you want to use that for.
I also think, I suppose, which is what I value you and Maya coming here. I think the school has this opportunity of mixing things. I mean, it's been very helpful to me, to get this input from both of you. And so I also like these sort of charts of picking your brains as well, for things like this. So that's, to me, also very helpful. One of the challenges I find is trying to explain, Maya, that what I'm doing here is not going to be perfect. We've had to explain that everybody asks for a control group. Now, a control group is almost impossible, in this situation. So you have to use some of the small amount of words that you've got to explain why you're not doing things. So, so knowing these things is always helpful. So I must say, thank you.
I'm struck by the kind of uncertainty principle around who you reach. By definition, you reach the people who you could argue were less hard to reach. I'm glad hard to reach is in inverted commas. It's quite a stigmatizing term in itself, and it very specifically draws attention to the failure of our system to reach people. And I'm just wondering with regard to research, because certainly the peer approaches that we work on in delivery of care could have analogues in research. I'm wondering to what extent the identity of the researcher and the way that we can mitigate the differences between the researcher and whichever hard-to-reach group, subgroup, harder, hardest we're trying to work with. To what extent is it possible to minimize that distinction and to engage more hard-to-reach populations as a way to ensuring that research covers groups who are hard to reach?
I certainly know a little bit about both your research, and your person of the researcher is like quite critical. Steph has been immersed in that world for 8 years, so she has certain credibility, and likewise you yourself, Marion, you have a lot of credibility, and therefore people are more likely to respond to you and your study compared to if I came in completely blind, as it were.
I think it does take, I think some sort of level of, they do say that some kind of level of knowing them helps. But it shouldn't stop, don't be, you could still go out and do it, but it mightn't, if they don't like you, then it might also not be to your benefit. So those things are. So I just want to know also, if I may, what happens if you don't get the perfect precision? Doesn't matter.
Can I still react to this?
Yes, sorry.
No worries. I like the peer approach, but I'm not sure it's always helpful. For example, when doing research with sex workers, they do not want peer approaches. They do not want to be told by other sex workers what to do or not. And on the other hand, I also think that this is quite a narrow approach then, because then I could also say, if you haven't had an abortion, you shouldn't be doing research on abortion. And I don't think my credibility is defined, in my case, by my sexual orientation or my gender identity.
Wasn't suggesting.
But I've definitely looked into this and struggled with this for myself, but I'm credible based on what I want to do, not what I am.
Might it be important to have a broader conversation about reflexivity in all aspects of public health research, not just those of us who have a social science background, but that's foundational, because positionality, like that exact same thing about your relationship on a gender, on kind of demographic factors and lived experience, I suppose, it puts you a further distance away from the participants a lot of the time, even just in the fact that most of us have, like, some of us are working in contexts of poverty and lack of access to education. We've all got masters and PhDs. Even just that obviously puts a huge distance. But it's about kind of how you manage that, how you acknowledge that, how you know, and I agree that a lot of qualitative work is done in a much more like slapdash way where people don't give adequate attention to that. So I think it's an important point that may not be about you having to be the same as your participant, but to acknowledge that there is a big difference in work to moderate and manage that, increase comfort.
Just very quick add, I think it's worth distinguishing the role of peers and the relationship in reaching a population and establishing a sampling frame from providing the investigation and the research.
Picking up a bit on the RDS and the notion of peers and how you access it. Also, I think someone was talking about changing your methods, because with RDS, sometimes in hard to reach groups, the most vulnerable are actually the more easy to access, and you see a lot of commercial sex workers among MSM in China or among MSM in Nigeria or whatever the case may be, and the finding is that 75% of MSM are sex workers, which is entirely not true, and you're actually leaving behind those that are harder to reach because they arguably have more to lose. So the educated men, and then you can engage with different groups of peers who have the ability to access different groups, different sampling frames that you wouldn't access necessarily. They may be reached by the RDS, but they won't engage because the benefits are less than
Graham, yeah.
I'll take a step back a little bit. I think for me, the question is why do it? There's so much sampling and scientific challenge. And I think we would all agree that there's a moral imperative. We need to get those that don't have a voice included. But the second study really putting a scientific frame on it, and then coming to issues of reliability can undermine that purpose. You bring people that are have not been reached and allow a voice into the center or into where they need to be. And if you use a scientific method that you can't rely on because of all the challenges you have, it kind of undermines that. So it's just a question. I understand why you're having to do it. I think you made that very clear. But there are downsides to doing that, and I wonder how you see that tension.
I'm going to make one comment on that. I mean, Joe really said it. It's about being really clear about your purpose for carrying this out. And so, if the first purpose is to bring hard to reach or population that doesn't have a voice in, really any way you can do that is sufficient. The next step and a different question is, what are the things that are, what are the main risk factors? What are the interventions that are going to work? And that's different, and that's just going to cost lots of money, right? And I think it's being really clear about the purpose for a specific investigation, and that's the hard part of science, right? Coming up with a good question, a really good question, a question that you can actually explain is actually the hard part. And if you know what your purpose is for doing something, then lots of methods are. I'm sorry, I'm going to run. I'm in a meeting that's starting right now.
Okay, thank you.
Can you quickly, because
Because I think I hear a lot about the too costly overstay, but what we're not doing is a study of the cost of not including.
Yeah, and I mean, the other thing is like improve the health systems, the access to care, and everybody will have more opportunity, right? There's obvious answers which are not about hunting down the last lonely elderly woman in the village who's also having sex with other women and, has
And she's dead as well.
It's about improving access to care across the board, right? And that's really the answer. I've got to go.
That's what they do.
Yes, I agree.
Any last comments or questions? Okay, otherwise I'd like to thank you very much for coming and for a really interesting, robust discussion. The book is here to sign. Hello. Hi, how are you?